In this session, we are going to be looking at the topic Special Abdominal Tests. Hi, I'm Sharon. I'm working as an assistant professor at College of Nursing. The following are the objectives that I'll be addressing in this session. Special abdominal tests are done by the physician or the nurse when they need more clarity and to confirm certain diagnosis in relation to the GI system. The articles that are required here are a pair of gloves. The following are the points that needs to be kept in mind while preparing the client. Before abdominal examination, the client is instructed to empty his or her bladder. Help the client to lie supine with arms folded across the chest or resting by the sides. Slightly flex the client's knees by placing a pillow or rolled blanket under the client's knees. This helps to relax the abdominal muscles. Drape the client with sheets so the abdomen is visible from the lower rib cage to the pubic area. Warm hands are essential for the abdominal examination, as cold hands can cause the client to tense the abdominal muscles. Instruct the client to take slow, deep breaths, as this promotes relaxation. Special abdominal tests are done when the physician or the nurse suspects for the following conditions, such as ascites, appendicitis, and cholecystitis. Tests for ascites. The first test is testing for shifting dullness. If you suspect that the client has ascites because of distended abdomen or bulging flanks, perform this special percussion technique. The client should remain supine. Percuss the flanks from the bed upward toward the umbilicus. Note the change from dullness to tympany and mark this point. Now help the client turn on to his or her side. Percuss the abdomen from the bed upward. Mark the level where dullness changes to tympany. The normal findings are the borders between tympany and dullness remain relatively constant throughout the position changes. Abnormal findings include when ascites is present and the client is supine, the fluid assumes a dependent position and produces a dull percussion tone around the flanks. Air rises to the top and tympany is percussed around the umbilicus. Whereas, when the client turns on to one side and ascites is present, the fluid assumes a dependent position and air rises to the top. There is a marked increase in the height of dullness. This test is not always reliable and definitive testing by ultrasound is necessary. These pictures will give you more clarity as to what is discussed in the previous slide. The next test is performing the fluid wave. A second special technique to detect ascites is the fluid wave test. The client should remain supine. You will need assistance with this test. Ask the client or an assistant to place the ulnar side of the hand and the lateral side of the forearm firmly along the midline of the abdomen. Firmly place the palmar surface of your fingers and hand against one side of the client's abdomen. Use your other hand to tap the opposite side of the abdominal wall. Normal findings include no fluid wave being transmitted, whereas abnormal findings show movements of a fluid wave against the resting hand, suggesting large amounts of fluid being present. Again, this test is not completely reliable. The next is the ballottement technique. Ballottement is a palpation technique performed to identify a mass or an enlarged organ within an ascitic abdomen. Ballottement can be performed by two different ways, either single-handed or bimanually. In single-handed method, Use a tapping or a bouncing motion of the finger pads over the abdominal wall and feel for a floating mass. In bimanual method, place one hand under the flank and push the anterior abdominal wall with the other hand. Normally, no palpable mass is present. Abnormal findings show that in ascites, you can feel a freely movable mass moving upward and can be felt at the fingertips. The first picture here addresses the fluid wave test, and the second picture addresses the ballotment technique. A shows single hand method and B shows bimanual method. The next is we are going to be looking at the tests for appendicitis. The first is assessing for rebound tenderness. Abdominal pain and tenderness may indicate peritoneal irritation. To assess this possibility, test for rebound tenderness. Palpate deeply in the abdomen where the client has pain, then suddenly release pressure. Listen and watch for the client's expression of pain. Ask the client to describe which hurt more, the pressing in or the releasing, and where on the abdomen the pain occurred. Normally, there will be no rebound tenderness. Abnormal findings show that the client has rebound tenderness when he or she perceives sharp stabbing pain as the examiner releases pressure from the abdomen, which is referred to as the Blumberg sign. It suggests peritoneal irritation as from appendicitis. The next is testing for referred rebound tenderness, that is the Rosing sign. Here to assess, palpate deeply in the left lower quadrant and quickly release pressure. Normally, no rebound pain is elicited. Abnormally, pain in the right lower quadrant during pressure in the left lower quadrant is a positive Rosing sign. It suggests acute appendicitis. The next test is assessing for psoas sign. Here, raise the client's right leg from the hip and place your hand on the lower thigh. Ask the client to try to keep the leg elevated as you apply pressure downward against the lower thigh. Normally, no abdominal pain is present. Abnormal findings show that the patient has pain in the right lower quadrant, which is psoas sign, and it is associated with irritation of iliopsoas muscle due to appendicitis. Here the pictures show the technique of applying pressure and releasing and Rosing sign. This picture addresses the assessment of psoas sign. Assess for obturator sign. Here, support the client's right knee and ankle, flex the hip and knee and rotate the leg internally and externally. Normally, no abdominal pain is elicited. Abnormal findings show pain in the right lower quadrant indicating irritation of the obturator muscle due to inflammation of the appendix. Next is perform the hypersensitivity test. Here, stroke the abdomen with a sharp object, example a broken cotton tip applicator or tongue blade, or grasp a fold of skin with your thumb and index finger and quickly let go. Do this several times along the abdominal wall. Normally, the client feels no pain or exaggerated sensation. Abnormal findings show pain or an exaggerated sensation in the right lower quadrant, suggesting positive skin hypersensitivity, indicating appendicitis. The next is the testing for cholecystitis. Here, assess right upper quadrant pain or tenderness. Press your fingertips under the liver border at the right costal margin and ask the client to inhale deeply. Normal findings show no increase in pain. Abnormal findings show accentuated sharp pain that causes the client to hold his or her breath, otherwise referred to as an inspiratory arrest. This is referred to as the positive Murphy sign suggesting cholecystitis. This picture shows the technique for assessing obturator sign. This picture shows the technique for assessing Murphy sign. The following are the references. Thank you.